Today we're talking about something that affects millions of men and women worldwide: hair loss. Whether it's thinning, receding, or shedding, it can be frustrating and even scary. But here's the good news. There are steps you can take to slow it down, or in some cases, even reverse it. And as always, much of the answer begins with what's on your plate, not what's in a prescription bottle. Okay, let's talk about why we lose hair, the root causes. Now, hair loss isn't just about genetics, though genes do play a role. Now, here are some of the most common drivers. First of all, there's a hormone, DHT, dihydrotestosterone, a byproduct of testosterone, and it's notorious for shrinking hair follicles, especially in men. Menopause. Now, estrogen usually has a positive effect on hair follicles. So when estrogen lowers during menopause, many women notice that their hair looks thinner, their hair production goes down, and hair starts falling out. Now, here's bad news of menopause, and for anyone. Believe it or not, fat produces hormones. It produces both testosterone and estrogen. Now, for women, that testosterone production explains why menopause is frequently associated with increased hair growth where you may not want it: on your face, on your mustache, on your arms. Many women who supplement with testosterone with hormone replacement therapy also notice one of the side effects of trying to improve their libido results in the fact that for many patients, they're ending up shaving their mustache, shaving their beard, shaving their arms to get rid of that extra growth. So, and sometimes testosterone, particularly in women, can be your enemy rather than your friend. Other causes: inflammation and autoimmunity. Now, in some cases, your immune system mistakes hair follicles for invaders and attacks them. This is most commonly seen in alopecia. Also, hypothyroidism and Hashimoto's. Frequently, some of the first signs of Hashimoto's and low thyroid is that all of a sudden your hair starts falling out, your eyebrows, particularly on the sides of your eyebrows, begin to disappear. I see many patients who did not get the fact that they were hypothyroid, but were penciling in their eyebrows on the sides because they thought that losing their eyebrow hair on the sides was just a part of growing older and just a deficiency in menopause, when in fact it was actually Hashimoto's thyroiditis that was causing their low thyroid in the first place. Finally, and I've said this many, many times before, the biggest driver of low thyroid in this country is not enough iodine in the diet. And just this week, again, I saw a new patient, a woman, who had low thyroid, had very high TSH, low thyroid hormones, had thinning on her eyebrows, and within 3 months of putting her on iodized sea salt and giving her a very cheap supplement that contains iodine from kelp, her eyebrows grew back, her thyroid functions normalized, she did not have Hashimoto's thyroiditis, and it was just giving her back iodine in her diet. Now, why is that such a big deal? And I've talked about this before. Iodine is so important in our diet and so deficient in most of our diets that the federal government, along with 20 other countries, mandates that salt makers put iodine in their salt. When Himalayan salt and sea salt came out, and people said, oh, it's got so many great things, unfortunately, neither Himalayan salt nor sea salt has iodine. So you've got to put iodine back in your diet. The easiest way? There's now iodized sea salt, many brands. I think I have 5 different brands in my cabinet. And now there's iodized Himalayan salt. And I'm trying that out right now. So there's no excuse for not getting that in your diet. And you'll be amazed how that'll help your hair growth. Now, there are many nutrient deficiencies that we also see cause hair loss. They include low iron, low zinc, low biotin, low vitamin D, and certain B vitamins like biotin can all trigger shedding. Finally, you ought to know that we also have to have silica to make hair. Silica is basically sand, and there are easy-to-use silica supplements. No, you don't have to go out and eat sand, that you can drip into your coffee. My wife and I both put a few drops of silica in our coffee every day. Stress, both physical and emotional stress, can push hair follicles into a resting phase, leading to excessive shedding weeks later. Now, why do you do this? Well, it turns out that hair is, if you will, a luxury. And if our system senses stress, whether, again, it's emotional stress or physical stress, or whether we're going on a really extreme low-calorie diet to lose some weight, or we're doing an extended fast to purge our body or lose some weight, your nutrient sensing system says, uh-oh, a famine has just occurred, or uh-oh, our body is under attack. And the last thing we want to do is waste precious resources in making hair, in making nails. Those can wait. We need to use every available protein, collagen, where things matter. And so we're going to jettison making hair for a while. We're going to slow down the production of nails, and we'll even make skin. Not very important. So amazingly, many people who go on an aggressive weight loss program, they report that their hair's falling out. Well, you're just saying, yeah, that's not important anymore. And amazingly, when you stop doing that or settle on a new weight, miraculously, your hair starts coming back. So, and I see this in my practice all the time. People panic that, oh my gosh, this program, I'm losing weight, I'm great, but my hair. And I just say, just don't panic, watch a couple months, you'll know it comes right back. And sure enough, it does. Let's talk about gut health, my favorite subject. Sadly, a leaky gut creates systemic inflammation that can do two things. It can interfere with nutrient absorption, and your hair is one of the first places that you'll notice it. Plus, if you have systemic inflammation, your body says, oh my gosh, we're at war, and we need all hands on deck, and we need to supply our troops, your immune system, with the food they need to fight this perceived battle. And it's a real battle. So once again, if we've only got so many resources to go around, who are we going to cut off? Well, the less important things like hair. So that's why you want to realize that if your hair is, despite all of this, not coming back or continues to thin, I keep telling people, look in their gut. And are you under attack? Now, there's fairly easy ways to do this that even your doctor can check for you. Make sure during your routine physical that you have markers of inflammation drawn. And almost all insurance companies pay for this. One of the easiest ones is HSCRP. Now, that stands for either highly sensitive C-reactive protein, or some people call it heart-sensitive C-reactive protein or heart-specific C-reactive protein. But it's a good generalized marker of inflammation. There are more sophisticated markers of inflammation that I do in my clinics, like IL-16, like tumor necrosis factor alpha, TNF-alpha, and I could go on and on. But your regular doctor can certainly check C-reactive protein for you. Look at all of these things I've just talked about. I find it very useful to have certain B vitamins checked by your physician. Vitamin B12, folate, homocysteine can also give you an idea of your B vitamin status. So the next question is, are prescription remedies worth it? Now, there are a number of prescription remedies that, in fact, do grow hair. The most famous is minoxidil, which is called Rogaine. Now, this can stimulate hair follicles and increase growth. But usually the attempt is temporary. When you stop using it, you'll likely lose the gains. Another drug that's extremely popular, which is an oral drug, is finasteride, Propecia. Now, this blocks DHT, which usually does help with male pattern baldness. But beware, the side effects, which unfortunately I see in my patients, include decreased libido and even depression in some men. My take, yeah, these can definitely work for some, but they really don't address the root causes. They're like patching a leaky roof instead of fixing the foundation. Now, number 3, are there foods that can help prevent hair loss? Well, if you want stronger, healthier hair, start in the kitchen. First of all, leafy greens and cruciferous vegetables are packed with folate, vitamin C, and antioxidants that support collagen and circulation to the scalp. Avocados and olive oil. Now, they're rich in healthy fats and vitamin E, which protect follicles from oxidative damage. Plus, olive oil gives you the additional benefit of polyphenols. And polyphenols, if you may remember, are some of the favorite prebiotic foods for gut bacteria. Always remember that the lining of your gut is your skin turned inside out. And as I always try to remind my patients, what happens in your gut, what happens in the wall of your gut, is reflected on your skin, and for that matter, your hair. So if you have a healthy gut and a healthy gut lining, you'll have a healthy head of hair. A number of years ago, before I started my program, I had a fairly prominent bald spot on the back, and my kids used to kid me about it. And I wasn't too worried about it. But lo and behold, when I put myself on my program now 30 years ago, lo and behold, my bald spot grew back. And if you notice, I'm 75, and my maternal grandfather was bald as a billiard ball, and I should have inherited that tendency. But in fact, there it is. And I owe that to the fact that I changed my microbiome by changing my diet. I repaired my gut wall. Lo and behold, my hair grew back. What about pasture-raised eggs? Well, pasture-raised eggs are a great source of biotin. They're a great source of choline and high-quality protein, all essential for keratin production. Think about fish, particularly wild-caught salmon, sardines, anchovies, herring. They're loaded with long-chain omega-3 fatty acids and vitamin D, both of which have been shown to support scalp health and follicle activity. I know I've mentioned polyphenols in olive oil, but there's other great polyphenol powerhouses like pomegranates, like green tea, like blackberries and raspberries. Polyphenols help reduce oxidative stress, they feed good gut bacteria, and that prevents the damage to hair follicles. Are there supplements that may help support hair health? Well, collagen peptides can provide amino acids for keratin production. Now, these peptides may actually help if they're fermented peptides. Biotin, vitamin B7. Now, it's often marketed for hair and for good reason. Biotin has shown to help hair growth. Now, men, saw palmetto is a natural DHT blocker with some research to support it. You'll often see these advertised as prostate health supplements. But if hair loss is an issue, and by the way, you can have your DHT levels measured, and if you find that they are high, then saw palmetto is a much safer way of attacking this than other products. Vitamin D. Vitamin D deficiency is strongly linked to hair loss. Plus, vitamin D improves your microbiome diversity and helps restore the wall of your gut. How about polyphenols like resveratrol and quercetin, sometimes pronounced quercetin? These can calm inflammation at the follicle level. So good polyphenols are good for your hair. And many Gundry MD supplements have polyphenols. For instance, one of my favorite supplements is BioSkin Youth Complex. It not only contains multiple polyphenols, but it contains 2 strains of bacteria that have been shown to actually improve hair growth in studies. So why not hit it both where it happens? Both the microbiome and polyphenols. Are there lifestyle factors that matter? Absolutely. Any way you can do to manage stress, the better your hair is going to do. Whether it's meditation, whether it's walking, whether it's getting a dog or a cat, and quality sleep all help reduce stress. And that will help reduce stress-driven hair loss. Now, what about scalp care? Well, the jury is still out. Red light therapy, which has been shown to improve skin health, may be an intriguing option for hair growth. It's certainly not going to hurt you, but like I say, the jury is out. And there are, as you know, many devices that are touted with red light therapy for hair growth, even red light therapy combs, helmets. The jury's out, but it's not going to hurt you. Avoid toxins. Try your best to avoid hair dyes. These are harsh. Try to avoid Brazilians. These are a real great way to destroy your hair and potentially damaging your follicles. How about trendy topics in hair loss? Well, one of the darlings is PRP injections. This is platelet-rich plasma therapy. Your own blood platelets, those are the things that actually clot your blood when you cut yourself. You extract these blood platelets, and they're extracted from your blood, they're concentrated, and they're injected into the scalp. Now, it is promising because it does work in joint inflammation, and it's really pricey, and it's really not for everyone. As I mentioned, low-level laser therapy helmets. These can be used to stimulate follicle activity. And there are a few small studies that suggest benefit, but again, the jury's out. I think the most promising is the gut-hair axis. Now, more and more researchers are finding links between gut microbiome diversity and hair follicle activity. So yes, once again, fix your gut, you're most likely going to fix your hair. And that was certainly the case in my own personal experience.